Welcome to part 2 of our Forward Thinking Sustainability series. I'm Deepak Jobanputra, Vitality's Chief Sustainability Officer.
And I'm Kate Anderson, a Sustainability Actuary here at Vitality.
In our first session, we covered what sustainability means, why it's important. For part 2 today, we'll focus on the link between health and sustainability, addressing 3 key areas before we head into our live expert panel discussion. We're going to cover the connection between health and climate change, the impacts of good health on society, and sustainable healthcare and how it affects us all. So how does climate change affect our health? Extreme weather events like heat waves, floods and droughts are becoming more frequent and severe, impacting our health in various ways. For instance, heat waves can cause food and water shortages, increase the spread of disease, heat stroke and worsen existing health problems such as lung conditions. This will have a huge impact on our healthcare systems globally and also on insurance markets. And this is why it is so important that we understand the risks and take action. Now, the World Economic Forum estimates that by 2050, climate change will cause 14.5 million deaths and $12.5 trillion in economic losses. Now, that's quite alarming.
Climate change also influences global supply chains. For instance, rising temperatures and heat waves are already having an impact on economies. But on the other hand, rising temperatures and heat waves can destroy crops, impacting our global food supply chains and the risk of malnutrition. This could also lead to potential loss of livelihoods, forced migration, and not to mention the huge impact on mental health, placing additional strain on healthcare systems. Take sea level rising as another example. This will lead to coastal erosion, meaning people will need to migrate to new homes. Imagine, places like Amsterdam might be submerged if we take no action. In England, around 6.3 million properties are at risk of flooding. And it's not just the damage to our homes that we need to worry about. Flooding can also affect our water quality, making it saltier over time. And that's a problem because too much salt in our diet is linked to higher rates of cardiovascular disease. So it's not just an environmental issue, it's a health one too.
The immediate dangers of wildfires are more visible, but there's also a hidden threat: air pollution. You may remember in 2023, the orange skies in New York, which were caused by the Canadian wildfires. Now, these news headlines grab your attention, but don't necessarily tell you about the long-lasting effects of air pollution, such as respiratory illness, allergies, and asthma. In India, if the air quality met the World Health Organization guidelines, then people there would live on average 4 years longer. And it's not just the air we breathe. Nature plays a huge role in our health. Around 70% of cancer treatments come from natural sources or are inspired by them. So when biodiversity is lost, we risk losing access to life-saving medicines. That's a really hard-hitting example for action for our health. And due to its health impacts, the elderly in society, children, and people with chronic illnesses are especially vulnerable to climate change, which can further widen inequalities in society. In the UK, extreme weather events and air pollution are major concerns. According to The Lancet, a medical journal, pollution is responsible for 9 million deaths annually, and this could worsen with climate change. As Dr. Tedros from the World Health Organization puts it, the climate crisis is a health crisis. It's a really simple statement, but a really powerful one. And it reminds us just how closely our health is tied to the health of our planet.
Now, sustainability isn't just about climate change. It's much broader than that. At the core, it's about creating the conditions for people and communities to thrive. And good health is absolutely central to that. Without it, everything else starts to unravel. The pandemic was a powerful reminder of just how fragile things can become when health systems are under pressure. That's why prevention is so important. It's not just about treating illnesses, it's about helping people stay well in the first place. We recently launched a paper with the UN and other global insurers called Health is Our Greatest Wealth. It's a great reminder that sustainability and innovation go hand in hand, and that when we focus on health, everyone benefits.
And our Britain's Healthiest Workplace research evidences the link between good health and improved productivity through reduced absenteeism and presenteeism. From this, we know the importance of preventative health measures and the role of employers in fostering a healthy work environment, highlighting the impact of good health on society. At Vitality, prevention is at the heart of everything we do. Last year, we launched our Habit Index, which showed just how powerful healthy habits can be in reducing the risk of non-communicable diseases. The results really speak for themselves. Members who actively engage with Vitality Programme not only enjoy better health outcomes, but also significantly lower healthcare costs. In fact, our data shows that engaged members could live up to 5 years longer. That's a huge impact. And it's not just individuals who benefit. When businesses invest in employee health, the returns are clear. Lower healthcare costs, better engagement, and improved retention. The World Economic Forum's Healthy Workforces Initiative is a great example of how organisations are stepping up to prioritise holistic workplace well-being. Our own research through Britain's Healthiest Workplace also shows a strong link between good health and productivity, with fewer sick days and better performance overall. All of this reinforces a really simple truth. When we prioritise prevention and create healthier environments, especially in the workplace, everyone wins. It's good for people, good for business, and good for society.
Good health and well-being are the foundation of a thriving society and a strong economy. But to be truly sustainable, healthcare needs to meet today's needs without compromising the resources future generations will depend on. That's where things get tricky, because the healthcare sector itself contributes nearly 5% of global greenhouse gas emissions. That's actually more than the aviation industry. But there's good news. Digital health solutions are helping to turn the tide. By moving services online, we can reduce unnecessary travel, cut emissions, and make care more accessible. Now, even though there's been a lot of focus on net zero in the press recently, the NHS is leading the way with an ambitious plan, aiming to reach net zero emissions by 2040. They've introduced a clear roadmap for suppliers, requiring all new contracts to include a carbon reduction plan. And by 2027, this will apply to all suppliers, including small businesses.
The private healthcare sector is also stepping up. Around 70% of members of the independent healthcare provider network have committed to reaching net zero by 2035. Collaboration is absolutely key. Whether it's the NHS, private providers, or insurers, working together is essential to drive innovation and make healthcare more sustainable, more affordable, and accessible for everyone.
To quickly recap, climate change is already impacting our health, and good health and well-being are essential for a thriving, resilient society. The healthcare industry also has a vital role to play in reducing emissions and helping to secure a sustainable future for all. Now, we're excited to dive deeper into this important and complex topic with our expert panel. So please do share your thoughts and questions in the chat. See you in just a moment.
Welcome everybody. I am enormously excited to see this kind of diverse and influential broad spectrum of stakeholders here today. The largest collaboration between the UN and the insurance industry.
So exactly 1 year ago we launched that ESG guide, and today we're so happy that 1 year after we're gonna push the agenda further on how life and health insurers can close the health insurance protection gap and drive better health outcomes through a more preventative healthcare model globally.
This paper is hugely relevant right now. The pandemic highlighted the importance of access to healthcare, the importance of resilience. Individuals must take a more proactive stance and maintain a better lifestyle in terms of health, wellness, and resilience. But macro trends are conspiring against this. The protection gap is widening. Health systems are under strain. Aging populations will further exacerbate this. We have a mental health epidemic that is huge and worrying. Yet preventive healthcare and spending on preventive healthcare is very, very small and remains low, and this is the challenge.
Essentially, this paper aims to address the problem statement: what can insurers do to help close the health insurance protection gap and facilitate a preventive healthcare model globally? So through this paper, we also like to demonstrate the key role that life and health insurers could play in addressing a variety of ESG risks that is associated to the topic of healthcare.
There's a lot of anxiety, facing society, and we see that emanating through a lot of the health issues that come about. Mental health that has surged tremendously globally across the globe, and there are a lot of issues to kind of solve for. So we as insurers, I think we really need to look at ourselves really hard, and I'm really somewhat being kind of controversial in saying there's a call to action here. We've got to really step up and not just rely on the traditional insurance models that we've adopted for years and years and years.
Dear colleagues and friends, health does not start in hospitals and clinics, but in the air people breathe, the food they eat, and the conditions in which they live and work.
Together we are creating a movement that will reshape the life and health insurance industry for the better.
Welcome, everyone. Thank you for joining us and thank you for staying with us so far. Welcome to the live panel discussion of our Sustainability for Advisors webinar series. My name's Adam Saville, the Chief Editor for Vitality, and I'm delighted to be your host for the next 30 minutes or so. We've got a really exciting session lined up, focusing on the intersection between sustainability and health and how financial advisors can leverage this connection to have more meaningful conversations with clients. Before we dive into the discussion, I'd like to take a quick moment to reflect on the recent UN's Health is Our Greatest Wealth report. You've just seen a quick video showing some of the highlights from the event that we ran at the Vitality offices in 2023. I'm turning to you quickly, Deepak. Can you give us a bit of context to this? Why was this such a landmark report, and why was that event such an important one for our industry?
Sure, Adam. I think it was a real moment where we had the opportunity to bring together world leaders around insurance specifically, and really importantly, life and health insurance. So very, very relevant to us. And the intent was to bring sustainability and life and health insurance together and look at ways in which the industry can really have a laser beam focus to have an impact in this space. So, we had a delegation from the United Nations, World Health Organization, Geneva Association, and even a address from the chairman of from HSBC with a real commitment to actually drive change and find solutions. And in essence, the paper points to real world solutions. There was a 4-point plan within the paper. Firstly, around kind of driving accessible and affordable insurance products, which is clearly really very important because it's one of the reasons that's cited as to why consumers won't buy insurance. Prevention is a second theme, really, really important. Natalie and Adrita will talk about this in a lot more detail, but new insurance model whereby if you've got risks that are controllable or modifiable, actually reducing those risks to create a more sustainable future, delve into protection gaps and create resilience, and kind of setting things up for Natalie and others to talk about this in a little bit more detail. Thirdly, really using technology, AI, data, and I see there's a question on this theme, but using it as an enabler to actually improve health outcomes for society. And fourthly, really looking at policymakers, working with governments, regulators, legislators, and really collaborating in this space. And in the world of sustainability, actually, the new form of competition there is actually collaboration. So it was a real coming together of the whole industry. And this is where, again, we're extending our reach into advisors to really have an impact, because I genuinely believe that advisors have a significant role to play within this space.
Thanks, Deepak. And it really has sort of like paved the way to us to bring about this series. So thanks for everyone for joining and tuning in today. So let's get into it. So as you've just mentioned, Deepak, we're joined by two esteemed experts in their own right. We've got Adrita Bhattacharya. I'm sorry if I've pronounced that wrongly.
It's Bhattacharya, Adam. It's Bhattacharya-Craven. You can call me Craven. That's easy enough. Yeah.
And you're the research director for health and demography at the Geneva Association.
That is correct. Yes. So shall I?
Please,
begin?
Please tell us a little bit about yourself before we kick into it.
So yes, but firstly, thank you, Adam and Deepak and the Vitality team for having me here today. As Adam mentioned, I am the program director for the health and demography research here at the Geneva Association, which is, funnily enough, not based in Geneva. It's based in Zurich, where I am right now. And in terms of my background, I am a mild form of health economist, you can call me that, and really specialize in two things. One is health financing policy, but also private sector integration in health and care ecosystem. And really the work that I lead here in the Geneva Association for almost 5.5 years has been looking at how the risks in the outside world are shaping up and how that is really transforming the typical biometric risks that are managed by the whole umbrella of product lines that are put out there by life and health insurers. So, so really understanding what technology is doing, what climate is doing, how mental health problems are emerging, and really understanding what that impact might have on insurance, what it can do, what it can't do, what are the challenges ahead. That's really the whole breadth of work. I'll stop there.
So really sort of joining the dots between climate change, health, prevention, resilience, all these different things, and with a bit of a view of how that might impact the financial services industry through insurance. Really fascinating stuff. And Natalie Kelly, you're head of life and health, global underwriting, claims and R&D at Swiss Re. Please, could you give us a quick overview?
Sure, Adam, happy to. Thank you very much for having me as well. So in my role, I'm a pricing actuary by background, and I spent many years in the insurance industry in the UK market as well, across product development and pricing. But in my current role, what I do for Swiss Re at a global level is sort of looking into what are the factors that impact how we understand individual customers' risks and what that means for how we develop and design products, but also looking at what are some of the real long-term drivers of future mortality and future morbidity. As a company, we've got a $200 billion liability on our balance sheet. This is the present value of all the future claims that we expect to pay if everything goes according to plan. So anything which impacts human longevity, human life expectancy, and sickness is of a great deal of interest to us. And these topics around sort of preventative healthcare, the impacts of climate change and the environment, these are all things that we pay a lot of attention to and are very vested in.
Really great, and really sort of taking a global view of risk, ultimately. Brilliant. So thanks for that, Natalie. Deepak, I'm sure you all of our viewers are familiar with you by now, Deepak, our Chief Sustainability Officer at Vitality, and an authority in all things prevention, behaviour change and sustainability, both from an operational and policy point of view. I won't put you on the spot, Deepak. No offence, but I think we've heard quite a lot from you so far today. Let's get things started with a poll. On a scale of 1 to 5, please, could our audience viewers, those of you tuned in, tell us how much you think your clients understand the link between health and life insurance and sustainability. So a bit of a kind of a read there across our audience of whether that link is being made amongst your client base at present. And we'll turn to those results a bit later. But to kick off the discussion, let's start off with a fundamental question, and then we'll get deeper into the topic as we go along. the statement, I think, is very true, and hopefully something we've established already today is that sustainability is much more than just climate change. Yes, it's an incredibly big part, but it's not all we're talking about. So why is it impossible to separate sustainability and health? And I'm going to come to you first, Adrita, and then we'll turn to Natalie and Deepak.
Sure. Well, thanks, Adam. I think if I can start with the big picture and some numbers just to help demonstrate the connection here. So we all know by now 2024 was officially the warmest year on record. In 2022 summer, Europe experienced 62,000 deaths due to extreme heat. Again, that process repeated itself in 2023 summer, where we lost close to 48,000 people in Europe alone. So these numbers may feel abstract, but these are the very real link we are starting to see between sustainability, very often equated to climate and environment, which is indeed an integral part of it, but there are other aspects, and health. And this is happening in the UK. There are, in fact, exploratory data sets from some insurers that are starting to show a very plausible link between extreme heat and excess mortality in the insured population, which nonetheless still needs further validation. What more, the brunt of the burden of death is being borne by older adults. So, for instance, people who are over 80 years old accounted for more than 4 times of heat-related mortality compared to those in their 60s and 70s. They made up more than 7 times more compared to the younger groups. And in the UK, this matters deeply. Our population is aging. As we know right now, 19% of the UK population is over the age of 65, and this is projected to rise to about 27 in the coming decades, 27%. And this demographic shift reflects the sheer volume of people who may have these risks exacerbated by climate risk. And why do I say that? Because climate change may start, and I would also add climate change and environment may start to affect the various biometric risks, which I alluded to in my opening remark, that are typically handled by health and life insurance products. So mortality risk, longevity risk, so how people age, their health, their expenses related to health and other things in later life, their morbidity risks such as chronic illnesses, all of which has an impact on the cost and design of insurance products. So for me, being here, the question of the hour is how we put the information out there for people to understand this in a simple way, and how that might affect their future and how they can protect against it. So I'll stop there and pass it on to you.
Really interesting. So Natalie, what we're seeing then is kind of this is impacting longevity, it's impacting comorbidity, and what I'm hearing from Adrita as well is it's very much affecting the older generation.
Yeah, it is. And Adam, as we said, climate change is much more than just an environmental issue. I think what's important to acknowledge, and the way we think about it, is that health risks from climate change accumulate over the course of someone's lifetime. And then at the same time, climate factors can compound ill health and increase the chronic burden of chronic disease as well. And so for us, what goes hand in hand with this at Swiss Re is that prevention, lifestyle behavior over the course of somebody's life is really important, and has been at the heart of some of the conversations we're having within our life and health business. We're proud to be thought leaders and very active in this space. A couple of years ago, we launched the concept of the Big 6 lifestyle factors, which we have now distilled down into a more recent focus on metabolic health. And here we're starting to look at things like health intervention programs, lifestyle changes, and new product ideas that can really help to prioritize prevention. Metabolic ill health is rooted in lifestyle factors like nutrition, primarily ultra-processed foods and carbohydrates, but also poor sleep, stress, and physical inactivity. These are all things which I think we can relate to in a daily life, sort of regardless of age, but something which we all feel. It is also linked to obesity, diabetes, and cardiovascular disease. So the link between metabolic ill health and these diseases are there. But we're increasingly seeing biological evidence and pathways with associations to things like cancer as well, mental illness, and even neurodegenerative diseases. So metabolic ill health and how this is compounded by climate change is important for us. And that also means that old adage that prevention is better than cure has never really been more relevant. Maybe just something to be aware of and to bring it into focus is that globally, non-communicable diseases like cancer and heart disease are responsible for 75% of deaths globally. Varies by country, but that's a broad global stat. And these are driven by common risk factors, these diseases of obesity, high blood pressure, high cholesterol, and diabetes. So these common risk factors can lead to multiple different disease pathways. So fixing metabolic ill health and dealing with these can significantly reduce premature morbidity and mortality. And that could potentially be exacerbated by climate change. So this element of prevention for us is really important.
Fascinating stuff. And Deepak, from your side, I mean, there's a lot that we can't control, right? I mean, I guess kind of global warming is to a degree inevitable, but obviously there are steps being taken to reduce that and push towards net zero, which should obviously limit the impact of climate change on our health. But there's also, from what Natalie's just said there, so much that is controllable or could be modified or could be impacted by behavior change. And we're talking about prevention here from a kind of a lifestyle point of view. And Deepak, that's very much kind of like the playbook of the vitality proposition, but also it's a topic you're very passionate about.
No, absolutely. And before I dive into that question, I can't help but kind of see the question that's being asked in the chat. So I would urge the audience to kind of throw in their questions in. One of them kind of points to, it's great having these big picture statements, and they are really important. The points that Adrita and Natalie are making are fundamentally important. And the question being asked, I think, centers around, what do we do practically? What do you want us to do? And that's been a theme within these webinar series around how do we make this kind of digestible? And I think that is really, really important. Now, we started off with the first webinar around what is sustainability, and quite simply, I say it's kind of making the world a better place. And the Sustainable Development Goals from the United Nations are a great framework for that. And within one of those, it's good health and well-being, and everything's connected. So, the climate emergency is a health emergency, and everything, all of those issues are interconnected. And I think advisors play a significant role in shaping the lives of their clients. It's not just financial advice or guidance they're giving, it's actually helping them lead the best lives that they possibly can. So within that framing of, where you were just talking about prevention, clearly that's the vitality model. And healthy people need a healthy planet. So that interconnection, again, comes into play really, really very strongly. So, and that was the theme of the United Nations paper as well, which is all around kind of prevention and new models that help drive, a better world. So we know that resources are constrained worldwide across kind of all the whole value chain, particularly in the health sector. And we see that in our headlines every day on the news. The NHS has got its challenges. Post-COVID, we've been struggling. Productivity in the UK. And see, that's an important link because it does have commercial impact. The health of the nation has a massive direct impact on GDP. And that's why we say this whole model is going to become a license to operate and thrive. It's operating for big businesses. We get a lot of pressure from governments and regulators to kind of report on sustainability, and that trickle-down effect. Kate talked about it in the video, that if you want to contract with the NHS, you're going to have a carbon reduction plan. That will work through the whole value chain. Your consumers, your clients are going to be asking for, what are you doing to make the world a better place? What are you doing around sustainability? What are you doing around climate emergency? And that's why this webinar series looks to kind of create that awareness so you can talk about it in a coherent, confident way, and then select products and services that align to that. And that's where, the points that Natalie was making around metabolic health. Well, traditional insurance where underwriting was done upfront and then it just fell away. It's just too dated. And now we need to look at all those risk factors around physical activity, eating well, sleeping well, And the same with other products and services like, car insurance. You can kind of affect behavior change within those markets and other markets as well. So with Vitality, clearly, our model is kind of rooted around that. Most engaged members within Vitality have 28% lower health costs. If you're, heavily engaged on the Vitality Life side, we just put out an advert that shows that you could live up to 5 years longer. So, the science and the data really proves this model. So this is sustainable insurance. That's what we're talking about here.
And Adrita, from your perspective, almost from a high macro level, what would you say to if an advisor said to you, and understandably so? I mean, I get it. I hear what you're saying. This is a massive issue, but at this point, it's not really affecting my client conversations. It's not something that's coming up. What would be your response to that?
Well, let me start with some practical examples of what your client might be suffering from, and let's see if we can make this a little bit more of a tangible discussion. So for instance, we just talked about extreme events here, right? I talked about heat waves, and there, we have these very unfortunate fatalities, and it's sad, and but it still feels a little bit further away. But let's not forget there are second order effects that are happening already. And I think some of which was pointed out already in the previous talk by Natalie and the video that was shown. So heat leads to drought. We know that. But the second order effect of a drought may be, it could cause a worsen chronic conditions like kidney diseases. And there is a very clear evidence of that. Ongoing exposure to hot temperatures is linked to cardiovascular diseases, pregnancy complications. I think there was a question about allergies and pollen. So it can make allergies worse. We have seen evidence of increased risks of vector-borne diseases. I think the displacement point was made at the video. We have seen links with cancer. Let's take the most common cancer that you can associate with skin cancer. But tell you what, also antimicrobial resistance, so antibiotic resistance. So imagine our stays in hospital becoming longer because some of the common antibiotics stop working or become less effective if we have an infection. That is a knock-on practical effect, and that is not far away from your clients. Those things are happening already and might get worse. And this tying this back to the demographic shifts, again, the argument, people are living longer and they are more prone to chronic illnesses, and that is associated with many of the conditions I've just outlined. And that, again, might be exacerbated by climate change. And I do think financial advisors have a key role to play here by helping policyholders understand and prepare for these slow burn risks and really look after their long-term prospects for both health and financial independence. We now live in a world where safeguarding house from extreme cold, heat, precipitation would become more important, not for the reasons we know already, but these are assets people rely on in order to fund their longer lives. But equally, prevention of ill health, to Natalie's point, would become a key strand of financial independence. I think, again, Deepak, you talked about productivity. We know from the stats from 2024 alone, at the early part of 2024, I think there was a figure by ONS released, 3 million working age adults in the UK were out of the labor market because of chronic illness. What do we think will happen to this if climate change or the environmental degradation remains unchecked? We also know from the UK that NHS is, NHS deals with 1.4 billion in annual expenditure for poor housing. Of that, almost 400 million is related to treating people with illnesses living to poor living conditions, cold living conditions. We need to create that narrative around the effects of climate change that goes way beyond natural catastrophe. It affects an ecosystem that supports, in my view, our economic and social architecture, and we cannot afford to destabilize it. If that is destabilized, a lot of the insurance market that we currently see in its current shape will also be affected by that. So I hope I can bring this down to planet Earth a little bit more. It may seem high level, but it's actually there are a lot of things that we are not thinking about when it comes to climate change, health, and your clients.
Yeah, and what you're speaking about, Adrita, really is health resilience, right? And setting yourself up for the best chance of success. And Natalie, I guess some of the things that insurers can do from a risk point of view is provide tools, innovate, and one of the SDGs being kind of innovation to try and withstand some of the challenges and pressures we are inevitably or likely to face. So Natalie, what role does the global insurance or even the UK market have to play here?
I'm going to really zoom in a little bit and talk about sort of maybe how we understand and select risk in the underwriting process, and how we can look to support people in that prevention journey. And especially, I think I'm hoping that I can make this quite tangible for advisors in the conversations that you're having with people who are applying and going through that selection process, basically. Maybe just a little bit of context. I don't think any conversation today about metabolic health and underwriting is complete without talking about lifestyle choices and weight loss drugs as well, and the role that they have to play. So if you'll allow me, I'll just zoom in there a little bit. We know that behavior change, lifestyle change is important, but for those who struggle with some of these initially to get started, there are pharmacological therapies like weight loss drugs, which are reshaping the treatment of chronic disease. They are now increasingly shown to impact more than just weight on the scales and BMI. And we're starting to see positive impacts across a lot of risk factors common to major diseases. Things like reducing high blood pressure, reducing high cholesterol, reducing blood glucose, and inflammation markers. So early data is starting to show that this is reducing cardiovascular and all-cause mortality risks as well. So for advisors who are speaking to customers who are going through that application process, I think increasingly people are thinking about what they can do, and maybe even customers who are disclosing that they're using these GLP-1 drugs to help them to make these changes. So I think that for life and health insurers, this is going to impact every line of business. So from life insurance, critical illness, disability, which I'll talk about shortly, and also medical expenses. So I think that these new developments call for new approaches to underwriting. You touched on that, Deepak, just now. I think we need to be more holistic in our risk assessment. We have updated our underwriting philosophy life guide, which is widely used across the market. So we've shifted to using percentage of body mass lost for somebody who discloses that they're on a GLP-1 or other lifestyle modification. We look at how long it's been since they've lost that weight. We look at that as what is the predictor of that for long-term sustainability. We also look at where the excess weight is carried, which ties in with the way doctors and the medical fraternity are now thinking about preclinical and clinical obesity, to try to make sure that we're tailoring our underwriting and the experience that applicants have and the information we ask them for, that they can understand how we're using that information. I will still say there is still some uncertainty about the long-term impact from these drugs, and we do need to continue to watch what that might mean. But maybe where I think insurers and advisors have an opportunity to intervene to promote good lifestyle and behaviors for optimal health, I think shifting from that reactive to proactive management creates a space for us to offer wellness incentives. And Deepak, the great work that you do at Vitality, really, I would put into this really strong category. We can use digital tools and preventative care to help people improve long-term health. It helps to boost customer engagement as well. We have seen that across multiple countries. It helps to ease, if people are taking care of their own health, it helps to ease pressure on healthcare, the healthcare systems. And also it improves workforce participation. So for employers, I think that this is a really important thing to think about. We've been proactively piloting a small number of health interventions in the UK with partners where we want to understand the impact that this can have. We're actually testing something on our own staff as well before we look to roll it out more broadly, and also with a small group of disability claimants, so people who have been on long-term disability claims. So in the UK, Dr. Campbell Murdoch is a GP who runs a metabolic health program. We have a very small number of disability claimants that we've put through that. And so far, for those who've been on the program, we've seen that 5 out of the 11 claimants who commenced the program have successfully returned to work. What I think means a lot to me is that one of those people has managed to cease medication for lifelong debilitating migraines, and 2 others have reversed their diabetes diagnosis, and their diabetes is now in remission. And this is a combination, it really is, it's not medication related, it really is just making those positive lifestyle choices around nutrition and sleep and physical activity. For our staff pilot, we have about 60 people there, so a slightly bigger group who've participated. 93% of them have self-reported that they've improved their diet. We've seen 55% of them have improved blood pressure, 50% improved their cholesterol. So these are really positive stories. And just listening to some of the stories that people tell about how they've struggled, and with a little bit of guidance and support have been able to make these changes, and it's really quite heartwarming. So I think the role that advisors have to play here is that your clients trust you. They believe that you will look after their interests. And if you are able to see how these kinds of programs and offerings can help them, and the link between the importance of prevention and living a longer, happier life, then they will believe you, and they will trust you.
Absolutely. And I guess there's an opportunity there, Deepak, to reframe the conversation away from one that's only about death, serious illness, if you're talking about life insurance, is only about access to treatment at the point of need. And you touched upon earlier, Deepak, that there's almost a kind of sustainability with a big S, which is kind of everything we're talking about on a kind of a global level. And there's almost sustainability with a little s around sustainability of care, right? Almost the sustainability of healthcare, to make sure that the services can be provided in a way that is the most streamlined, the most effective. I'll just add to Natalie's point around GLP weight loss drugs. One of the things I think is incredibly important is that people are supported through that journey, rather than just left to go and buy them from Boots or whatever. No offense to Boots, but actually just to administer them safely in a way that is controlled and part of a plan for the prescribed amount of time they are on offer for. So Deepak, it's almost like all these things can then start to build up a picture for how an advisor's conversation could potentially change in light of these huge global issues, social issues that aren't going away and are only going to get bigger.
Yeah, absolutely. And that question of what can I do as an advisor is a critical and a really big question. And I think there's a big role to play, as kind of Natalie and Adrita have kind of expressed here. And I think the issue is a systemic one, and it's understanding that health plays a significant role within that. And that's where, Natalie, you kind of expressed it really well there, just around, as advisors, you're guiding and advising your clients to lead the best lives that they can lead. And within that, health risk prevention, as we say, there's nothing more important than good health. And the best example of that was clearly COVID. You just look back 5 years and how we all kind of behaved. It really kind of showcased actually health was the most important thing. And time does a funny thing where we kind of discount it slightly. And with health, there isn't an explicit currency to measure it, right? Like money has kind of a number to it, health kind of less so. And we're heading in that direction with all the things that we're talking about around prevention, good health. So, the components are physical activity, eating well, sleeping well, all the things that have been mentioned, and linking it to social, human, and financial capital. And I'll just go on to say that what can I do as an advisor? Well, actually, those things that you can do for your clients have a massive multiplicative effect. And the more that we have a healthier nation, there's less pressure on society. So we create this kind of shared value where your clients are happier, they're healthier, they're leading better lives. There's less pressure on the kind of national health system. You've got greater productivity. It's kind of a no-brainer. Everybody wins. And in the next session, Adam, in webinar 3, we're going to go into even more specific detail with advisors on the webinar, talking about this as to what can you do on a real practical level in the day-to-day kind of space.
Yeah, definitely digging into those practical examples of what advisors can do whilst talking to clients and how they can operate it within their business. I'm going to try and last few minutes, and we'll, if everyone's okay, we're going to roll on for a minute or two beyond the agreed time, just to answer some of these questions. One that's quite specific about Vitality products. Kevin's asked about whether reversing diabetes could then maybe change the underwriting ramifications. I think, Natalie, I mean, the simple answer is probably yes, because at the point of underwriting, you'll end up considered less of a risk for products like serious illness cover and IP. But I'm not an underwriter.
I'm not an underwriter either, but yes, but that I think is fair, Adam. Right? So, I think the fact that you can put your diabetes into remission purely by changing your lifestyle, your nutrition as well, and basically bring yourself off medications. We've seen in the UK that I think up to 50% of diabetes can technically be put into remission, and that's brilliant, right? Not only because you get to come off medication, but also for what it means in terms of extending your life. So I think that that what we spoke about that sort of looking at the duration of weight loss, understanding what somebody's history is, and working with them there is certainly something which I think is a wonderful opportunity, right? And you speak to people. I've heard stories from people who are diabetic, and just knowing that you can take that into your own hands and bring about that remission, I think is a really powerful story.
Yeah,
it's getting people started on the journey.
Yeah, absolutely. I think that's a really, really good point. A question about technology from Damien. Do you think we should be taking a wider boundary view? For example, technology consumes more and more energy year on year. Our net energy consumption is increasing. So obviously one to grapple with, Adrita, and probably not one we can answer now, but I wonder if we can get a quick kind of like hot take from you.
So yes is the resounding answer here. I agree. As to having said that, I think there are both sides to the argument. I think there are technologies that are also enabling some more cost effective as well, environmentally effective ways of delivering services. So I am not an expert in this, and I am not going to go into the details of it. But I think knowing what I do about health tech, climate tech, I would say the argument goes both ways, but still a long way to go. And I think there is a point there.
Yeah, absolutely. A question has come in. We've already talked about kind of immunity already a little bit, but William's asked whether environmental pollution could be causing things like hay fever, or potentially even a weak immune system. I mean, these are things, it's kind of what you were talking to, isn't it, really, earlier, Adrita, is the fact that there are lots of interconnected kind of health impacts of things like environmental pollution. Obviously, we can't answer a diagnosis for your hay fever, William, but obviously that there is. I mean, the bigger kind of point here is that, I don't know, Adrita, you're the expert in terms of kind of like how these things. What's the best answer to give from a kind of a broad point of view?
Absolutely, I think pollution and air quality is a factor of many things, of which climate change and environmental degradation and CO2 emissions are big parts. So I think we need to be mindful about how we talk about that in order to have a very incisive discussion about it. But at the same time, there's clinical evidence, and in fact, I think the UK is the only country in the world so far where a death certificate for a young girl was actually written because of air pollution and poor air quality. And I think it was the first case in the world. And what got air pollution on the radar? Think about what happened in North America, in Canada, and all of that ashen wind that covered big parts and big swathes of Canada and North America a few years ago. We know what happened from that. So there's direct effect. We do not have to go through copious amounts of literature review for that. We know it is, down to, it has created problems with respiratory illnesses. It does have a problem with allergies. And it is therefore also related to cardiovascular diseases. So it goes back to, again, Natalie's point is that we have to do all these other things that are, beyond, I would say, the health sector, where we do need to think about the climate and what we are doing. But at the same time, I think resilience to some of these things are equally important. And I think that is where the preventative strategy for healthcare becomes so important. So how do you cope, and how well do you cope? And how being able to cope well with it means, what does it do to your level of protection you get from insurance, I guess, both for health and your finances.
Absolutely. And taking a proactive approach to that protection, not a reactive approach to it. And I was quickly read out the results of the poll before we wrap up with one final kind of like comment from all of our panelists. So on a scale of 1 to 5, we asked, how much do your clients understand the link between health and sustainability? Hopefully you as advisors are understanding it more and more as this webinar series goes on. A mixed bag. We saw 33% said 1 out of 5 in terms of understanding, 30% said 2, 27% said 3, and only 6% said 4, and 4% said 5. So yeah, I think there's a lot of work to do, and I think ultimately it's about kind of education, demystification, understanding, and awareness. And I was going to ask what's next to close, but I think I'm going to ask, what can advisors do now? And I know the next session will be on kind of operating it within your business as a license to thrive and tips for your conversations. But Deepak, I'm going to come to you first. And in terms of kind of what would be your recommendation on what we can start doing today to make this relevant to clients? And then I'll come to the rest of our panelists before wrapping up.
Yeah, no, great question. I think, just kind of quite simply, sustainable advice supports long-term well-being. So bringing it into the discussion, everything that Adrita was just kind of talking about around the environment and health. Actually, healthcare is a really carbon-intensive industry. It's actually more carbon-intensive than the aviation industry. So when someone takes a flight, you think, gosh, but actually, if we can reduce the demand for healthcare, and again, this is where advisors can play a role, be healthier, consume less healthcare, reduce your costs, lead a better life. That all starts to fall into the category of kind of responsible insurance, drives resilience, and actually could actually even grow your business because you're making it more affordable, more accessible, and you're connecting with your client base in the way that they want to be connected. Because if you think about Gen Z, millennials, again, there's lots of research and studies that show that this is what they want. There's studies that kind of show that 70% of consumers will pay more for sustainable products. Now, they may say that, whether they do or not in practice is kind of another question. But society is changing. So your kind of comment of, this is going to be a license to operate and thrive. And if you're in this category, you're more likely to be more successful.
Yeah. And I think that force for social good is something that the insurance industry can really support, and which is exactly what the principles of sustainability within insurance is all about.
Exactly.
Natalie, what would be your suggestion for an advisor thinking, what can I do today?
I think start talking about this to your customers and clients. As I said, you have the relationship with them. They trust you. This is not about insurance companies trying to avoid paying claims and saving money and protecting themselves. This is about, we all benefit if people live longer, healthier lives, and that's what we're able to offer and how we're able to do this. It's not just about paying a claim if and when it gets needed. Is we're on this journey together and we're all pulling in the same direction. So please do start talking to, if you're not already, do talk to customers about this and help them to see how what we are able to offer can help.
Thanks, Natalie. And final thoughts from you, Adrita?
Along very similar lines. I think, we can do the fanciest of products. We can bolster preventative strategies. We can do parametric insurance around health and the climate, as we have seen in some parts of the world. But people need to see the value. And if people don't see the value, they won't buy those products or they won't subscribe to those values. And so I think we doing research, and I guess, the technical folks and colleagues that I work with can do all of that. But I think the financial advisors are like the only conduit we have to the public. So I think the literacy has to be a part, and I can't emphasize that more. It's we can do the best of things, but if people don't want it, it won't happen. So I think you are really the foot soldiers here, and that's why I guess we are doing this conversation, having this conversation today.
Yeah, Yeah, and already doing a lot of good in putting in place the protection that people need, the healthcare that they may require, and let's keep pushing forward. I think that's the message I'm hearing. Well, thank you for joining us. I'm very sorry for overrunning slightly. I felt like it was such a valuable discussion. I wanted to get everybody's thoughts before wrapping up and answer your questions. But thank you again for joining us. Thank you to our speakers, Natalie, Adrita, and Deepak and Kate earlier on in the presentation. See you next time on Sustainability for Advisors, brought to you by Forward Thinking at Vitality. And have a lovely day. See you soon.
Bye.